Welcome to the Deep Dive. Teen Kairos is here with you again.
That's right. And today we've got a really curated look at some very recent clinical research.
We've pulled together 9 clinical studies, specifically ones that either got started or are, actively recruiting participants between January and May of this year, 2025.
Yeah, think of it as a snapshot of what's happening right now across different areas of medical investigation, a real-time look.
Exactly. We're trying to give you that express route to understanding some current work. So let's break down those 9 studies. We've got working sort of head to toe, one study looking at the oral cavity, then a pretty significant group, 3 studies focused on breast cancer.
Right, a lot happening there.
Then 2 studies in lung cancer.
Okay.
And then 1 each for the gallbladder, the cervix, and wrapping up with the prostate.
Quite a range. Covers a lot of ground.
It really does. And just a reminder, for any of these that catch your interest, you'll find links for all the deep details right there in the description below.
Absolutely. Dive in deeper if you want the full picture on any specific trial.
Okay, let's get started. Our first study, this one's focused on the oral cavity.
Right.
It's titled Low-Cost Screening and Image-Guided Photodynamic Therapy, PDT, of Premalignant and Malignant Oral Lesions. The NCT number is NCT 06876038.
Okay, PDT, photodynamic therapy. So this involves using a drug that reacts to light.
Exactly, a photosensitizer. In this case, it's 5-aminolevulinic acid. You apply that, then use laser light to activate it.
And the goal is to target specific lesions.
Yes, specifically premalignant and malignant oral lesions, things that look like they could become cancerous or already are. And they're using a new handheld device, too, called CTOS.
CTOS. Okay, what does that do?
Well, it helps them see inside the mouth and deliver that laser light precisely, so it's image-guided.
Ah, got it. So guiding the therapy directly to the problem spots, that sounds promising for minimizing damage to healthy tissue.
That seems to be the idea. They want to see if this PDT approach can actually cure these lesions without needing surgery.
That would be a big deal. Less invasive.
For sure. They're also checking if the lesions come back after treatment and, how easy the CTOS device is to use in practice.
Makes sense. And when did this one start?
Recruitment kicked off in May 2025. It's a collaboration led by UMass Boston, but involves Mass General, University of Arizona, and even international partners in India, plus the NCI.
Quite a team behind it. Okay, interesting start.
Right. Moving down a bit, we hit the breast cancer studies. First up, our second study overall.
Okay.
This one's called Study of PF 07220060 with letrozole in adults with HR-positive, HER2-negative breast cancer who have not received anti-cancer treatment for advanced metastatic disease. Long title.
Yeah, quite a mouthful. The NCT is NCT 06760637, and it's also known as 4-LIGHT-3.
And this one's already recruiting.
Yes, started back on January 6, 2025.
Okay, so HR-positive, HER2-negative. That's a very common subtype, right?
It is. Hormone receptor positive, HER2 negative. And these patients have advanced or metastatic disease, but crucially haven't had prior systemic treatment for it being advanced. First-line setting for advanced disease.
Gotcha. And they're testing a new drug, PF 07220006.
Right. In combination with letrozole, which is a standard hormone therapy, they're comparing this new combo against, well, the current standard of care.
Which involves letrozole plus one of the CDK46 inhibitors, like palbociclib, ribociclib.
Exactly, or ebenesezaclib. The investigator gets to choose which of those standard options to use in the control arm.
So the core question is safety and effectiveness of the new drug combo versus the established ones.
Precisely. Pfizer is sponsoring this one. It's looking to see if this new agent could be another good option, maybe even better in some ways, for these patients.
Okay, makes sense. Now the third study, still in breast cancer, title, A Study of Isolantamab Brengitide versus Chemotherapy in Participants with Previously Untreated, Locally Advanced, Recurrent Inoperable, or Metastatic Triple-Negative Breast Cancer ineligible for anti-PD-L1 drugs. That's Isobrite Breast 01, NCT number NCT 06926868.
Okay, triple-negative breast cancer. Often more aggressive, harder to treat.
And specifically for patients who aren't eligible for certain immunotherapies, the anti-PD-L1 drugs.
Right. So this study is exploring a different angle. What's the intervention?
It's a drug called isolantamab brengitide. It's described as a bispecific antibody-drug conjugate.
Okay, ADC, antibody-drug conjugate. So it delivers chemo directly to the cancer cells. And bispecific means it targets 2 things.
Exactly. It targets EGFR and HER3 on the cancer cells. The idea is to be more precise. They're comparing azabrin directly against the physician's choice of standard chemotherapy.
Like paclitaxel, nab-paclitaxel, carboplatin gemcitabine.
Or capecitabine, yeah. Those kinds of options.
This dual targeting is pretty cutting edge. Could be a really valuable new strategy if it pans out, especially for this group with limited options.
Agreed. And this one isn't recruiting just yet, right?
No, anticipated start date is July 15th, 2025. It's sponsored by Bristol Myers Squibb, working with SysImmune Inc.
Okay. One more in breast cancer, our fourth study.
Let's hear it.
This is a phase 4 study. Phase 4 study to assess the safety of trastuzumab deruxtecan in Indian patients. NCT 06429761, also called STRIDE.
Phase 4. So the drug, trastuzumab deruxtecan, is already approved. This is more about real-world safety, often in specific populations.
That's exactly it. They're looking specifically at the safety profile in patients in India.
Which is really important. Different populations can sometimes react differently to medications.
Right. The focus is on patients with unresectable or metastatic HER2 positive breast cancer who've already had some prior anti-HER2 treatment.
And the intervention is just trastuzumab deruxtecan itself.
Yes. Just evaluating its safety in this specific context. Recruitment for this started January 2nd, 2025, sponsored by AstraZeneca.
Good to see that focus on population-specific data. Okay, moving on from breast cancer.
Yes, let's move down to the cervix, our fifth study.
All right.
Title is A Study to Evaluate the Safety, Tolerability, Preliminary Efficacy of KRC01. That's NCT 05570422.
KRC01 sounds like an early phase study.
It is phase 12. So phase 1 is really about safety and figuring out the dose. Phase 2 starts looking for early signs of whether it works.
Makes sense. And what are they testing KRC01 with? Or is it alone?
Both, actually. In phase 1, it's KRC01 by itself. But in phase 2, they're combining it with standard chem radiation therapy, or CRT.
So that would be external beam radiation, cisplatin chemo.
Yeah, brachytherapy. Right, the standard package. They want to see if adding KRC01 can improve things safely.
Interesting. Combining a new agent with the standard backbone could be a way to boost effectiveness. When does this one start?
Anticipated start is April 1st, 2025. The sponsor is Cortic, Inc.
Okay, Cortic. Got it. Cervical cancer, early phase. Now where to next?
Let's move up to the chest area, lung cancer. We have 2 studies here. First is our 6th study overall.
Okay, lung cancer. What's the focus?
This one is comparing 2 different immunotherapy combinations for extensive stage small cell lung cancer, or SCLC.
SCLC. Very challenging type. First-line treatment.
Yes, first-line therapy. The title is quite detailed. A study to compare the efficacy and safety of BMS 986489, which is a combo of BMS 986012 plus nivolumab in combination with carboplatin plus etoposide, to that of atezolizumab with carboplatin plus etoposide.
Phew. Okay, let's unpack that. So one arm gets a fixed-dose combo of 2 immunotherapies, nivolumab and this BMS 986012, plus standard chemo, carboplatin.
Right, and the other arm gets a different immunotherapy. It's atezolizumab plus the same standard chemo.
Got it. So it's a head-to-head comparison of 2 different immunochemo regimens. That's valuable. The NCT is NCT 06646276, known as Tygos.
And it's actively recruiting.
Yes, started February 25th, 2025, sponsored by Bristol Myers Squibb.
Okay, important comparison for SCLC. What's the second lung study, our 7th study?
This one targets a specific mutation, non-small cell lung cancer, or NSCLC this time.
Right. The title is Study of Olomorasib, LY3537982, in combination with standard of care in participants with resected or unresectable KRAS G12C mutant non-small cell lung cancer, NCT 06890598, or Sunray02.
Okay, KRAS G12C, that's a known target now. Olomorasib is a KRAS G12C inhibitor.
Yes, designed specifically for that mutation. Very targeted therapy.
And they're looking at it in combination with what standard of care?
Well, it depends. The study has 2 parts. Part A is for patients whose KRAS G12C lung cancer was surgically removed, resected.
Okay, the adjuvant setting, trying to prevent recurrence.
Exactly. In Part A, they compare olomorasib plus pembrolizumab, that's an immunotherapy, versus pembro plus a placebo.
Got it. And Part B?
Part B is for patients whose cancer is unresectable, can't be removed surgically. There, they compare olomorasib plus a different immunotherapy, durvalumab versus durvalumab plus placebo.
Interesting. Testing the targeted drug plus immunotherapy in both the post-surgery setting and for unresectable disease, covering different stages.
Right. Really trying to see where this drug fits best. This one started recruiting March 27, 2025. It's sponsored by Eli Lilly, collaborating with AstraZeneca.
Makes sense given durvalumab is an AstraZeneca drug.
Okay. Personalized medicine in action there.
Yeah.
Where are we heading next?
Let's move to the gallbladder. This is our 8th study.
Gallbladder cancer. Don't hear about trials for that as often.
True. This one's called neoadjuvant chemotherapy for locally advanced gallbladder cancer, a randomized controlled trial, or NEOGB. NCT number is NCT 0671240.
Okay, neoadjuvant chemo, so chemo before surgery.
Exactly. They're comparing giving chemo first versus going straight to surgery for patients with locally advanced gallbladder cancer that's considered resectable.
And the main question is,
Does giving chemo beforehand improve overall survival at the 3-year mark? That's the primary endpoint.
a classic important question in oncology. Does shrinking the tumor first lead to better long-term outcomes? Pretty much. This is a randomized controlled trial, so it should give some solid answers.
Good. And who's running this?
It's sponsored by the Rajiv Gandhi Cancer Institute and Research Center in India. Started recruitment January 1st, 2025.
Okay, important work being done there. That leaves one more study.
One more, our 9th study, focusing on the prostate.
All right. Prostate cancer. What's the angle here?
It's about hormone therapy duration. The study is called Reduced Length of ADT in ARTE, with XRT in high-risk prostate cancer, RLAX, a randomized trial. NCT is NCT 06818682.
RLAX.
Okay.
ADT is androgen deprivation therapy, hormone therapy, basically. RTA is an androgen receptor targeting agent, like abiraterone or enzalutamide.
Exactly. And XRT is radiotherapy. So they're looking at high-risk prostate cancer that hasn't metastasized.
And comparing different lengths of hormone treatment.
Right. The standard is often 2 years of ADT along with radiation. This trial is comparing that to a shorter course, just 9 months of ADT plus 6 months of an RTA, like abiraterone or enzalutamide, also with radiation.
So a much shorter, potentially intensified hormone therapy period versus the long-term standard.
Yes. The big hope is that the shorter regimen might control the cancer just as well, but with significantly fewer side effects from the prolonged hormone suppression.
That would be huge for quality of life. Those side effects can be really tough over 2 years.
Definitely. This trial started recruiting February 17th, 2025, and it's sponsored by the Tata Memorial Center.
Another important study addressing a key clinical question. Okay, so that's our 9 studies.
That's the list. A quick run-through, thanks to Team Kairos, of 9 studies getting underway or actively enrolling between January and May 2025. We've gone from oral lesions right down to the prostate.
Yeah, it's quite a spectrum. And remember, we've just scratched the surface here. Each study has very specific goals, methods, patient groups.
Absolutely. This was just a snapshot. Is any particular study sounded interesting to you? Please do check out those links in the description. You can get the full protocol, eligibility criteria, everything.
It really shows the sheer breadth of research happening constantly, always pushing forward.
It does. And considering all this activity, all these different approaches, it kind of makes you wonder, doesn't it? What potential breakthroughs are you most curious about seeing emerge from this kind of ongoing research in the fight against these conditions?
That's a great question to ponder. Definitely something to keep watching.